Senator Thune.
All right. Thank you, Mr. Chairman, and Senator Crapo, and I appreciate your continued focus on youth mental health, and I appreciate the panel for joining us today. And as I discussed last week, when I talked to parents, teachers, and school administrators across South Dakota, addressing the behavioral health needs of students is a big priority. Dr. Hoover, in your testimony, you mentioned that we need to be looking for more formal partnerships with community behavioral health providers. We have multiple cooperatives in place in my state where schools that are in close enough proximity share a provider, but in some circumstances, distance is a barrier. Do you know of instances where the partnerships you refer to have been formed using telehealth or a combination of in-person and telehealth services? And what are the biggest barriers that schools or school boards encounter in forming these types of partnerships?
Thank you for the question, Senator Thune. Absolutely. We've seen actually tremendous partnerships that rely almost exclusively on telehealth, especially for some of our rural communities. Some of the best examples started in South Carolina several years back, where they had the Medical University of South Carolina providing telehealth services to schools across some of their most rural districts in South Carolina. So we've seen these community behavioral health partnerships with schools through kind of these standard memoranda of understanding with schools and community behavioral health, where sometimes they'll do some on-site support, but really much of the service that's provided is through telehealth. As we've mentioned earlier, some of the real barriers to that are reimbursement. Sometimes schools are not allowable as sites of service, and certain provider types are not allowable, which really does require taking a look at state Medicaid plans and thinking about how to expand school health programs under school Medicaid. And certainly just a lack of awareness of some of the guidelines for how you can set up these partnerships and get reimbursed and supported.
Yeah. Thank you. Doctors Benson and Hoover, Dr. Benson, you want to take this first, but youth mental health in Indian country has been a significant challenge for some time now. Some of the stories are heartbreaking. There was a 2017 Department of Education report that confirmed that kids in public schools on the reservation have a greater risk of behavioral health challenges, including increased risk of suicide. Do you have suggestions for how this committee can help improve access to culturally appropriate care on the reservations, especially how we could grow the workforce there, which is a challenge, finding providers, recruiting, and then being able to retain providers in tribal communities has really been a challenge.
Well, thank you, Senator, for that question. And we too struggle with the challenges that you identified. The Certified Community Behavioral Health Centers are an excellent way to attract clinicians of diverse backgrounds. Clinicians like myself of diverse backgrounds tend to focus on supporting populations that are similar, and so that the chances of working in your community are greater if you're a member of the community. How do we increase providers in those communities? By targeting the communities who need the treatment and identifying individuals in those areas and providing the support needed. So many of the challenges for minority populations relate to finances, high student loan burden, low support for strong academics in the community. Like, those are all areas where we would be able to support education, increase interest, and support individuals who would go on to get education in those areas. And some of our focus could be on supporting them in their communities. So many times in academia, we're all familiar with the idea that we recruit people away from their communities, as opposed to providing resources in that community to educate young people through their high schools, their community colleges, training programs, and then diversifying opportunities for support. So in line with Dr. Hoover's comments about task shifting, it's teaching people to provide services at the bachelor's level or other levels that will allow them to expand support for care in their communities.
Thanks.
Just to piggyback on that, in addition to recruiting members within communities and retaining them in their communities to support their communities, also investing in technical assistance and training centers and resources within those communities. A great example of that is the National American Indian Alaska Native Mental Health Technology Transfer Center, which is funded as part of the Substance Abuse Mental Health Services Administration. And then I'll just also add, really expanding the federal workforce development programs that we've already mentioned, including including loan repayment, but also things like the Minority Fellowship Program and National Health Service Corps can really help in this regard.
And I would add to that some of our national organizations that support children's mental health, the American Academy of Child and Adolescent Psychiatry, and other programs actually have minority-focused fellowships to support the development of other mental health professionals, and partnering with the HBCUs for Black families for programs and educational systems that primarily serve Hispanic and Native American youth would be places that we would be able to support development of professionals who remain in those communities.
Thank you both. Mr. Chairman, my time's expired. Thank you.